There are conditions science cannot fully explain. Morgellons disease is one of them. Patients describe crawling sensations under the skin, strange fibers pushing through lesions, pain, confusion, stigma. But in the medical community, debate rages. Is Morgellons a real disease or something else entirely? Fam, let's talk about Morgellons. Imagine waking up with painful sores on your skin, and when you look close, you see fibers poking out. Blue, black, sometimes white, like threads. Coming from you. Yeah, creepy. Some people swear it feels like bugs crawling under their skin. But here's the wild part. Half the medical world doesn't even believe it's real. So what is it? A physical disease? A mind-body connection? Or something science hasn't caught up to yet? Let's break it down.
Listen, baby, if fibers ever start crawling out of my skin, I'm calling the ER, my mama, and a priest, in that order, and then I'm suing somebody.
Not the priest, Milo.
Yes, the priest. Extra coverage.
In 2012, the CDC published a study on Morgellons. They called it an unexplained dermopathy, meaning doctors could not find a clear biological cause. Some researchers suggested psychiatric links, delusional infestation, where patients believe parasites live under their skin. But patients themselves insist their pain is not imagined. Cindy Casey, a registered nurse, developed open sores and strange fibers in the late 1990s. Doctors dismissed her, telling her it was psychological. But Cindy insisted her symptoms were real. She later became director of the Morgellons Research Foundation, advocating for patients who felt ignored by the medical system. See, Cindy wasn't just fighting her own symptoms, she was fighting to be believed. That's the heartbreaking part of Morgellons. People suffer physically and emotionally because the world doesn't take them seriously.
And let me say this, whether it's in your body or in your mind, pain is pain, period.
Morgellons disease sits in the shadow between medicine and mystery. Some call it delusion, others an undiscovered illness. But for patients living with sores, fibers, and crawling sensations, the suffering is very real. So, fam, tell me, if you had doctors saying one thing and your body screaming another, what would you do? Would you fight to be believed? Or would you start to question yourself?
And while y'all think on that, I'll be here with my lotion, because dry skin, that's already scary enough.
In 2012, the Centers for Disease Control conducted a landmark study on Morgellons. The results shocked many. Their conclusion? Morgellons was not a distinct disease, but rather an unexplained dermopathy, a skin condition without proven infectious cause. But for patients, this verdict felt like dismissal. So basically, the CDC said, "We studied y'all, and we don't know what it is. But it's probably not what you think." Imagine going to the doctor saying, "Fibers are coming out of my skin." And the official answer is, "Nope, that's just lint." Next? Like, what?
It's not real, it's just your imagination. Baby, my imagination doesn't itch, burn, and bleed. Don't play with me.
Say it louder, Milo.
And let me tell you, if I see blue fibers in my skin, that's not a Target sweater shedding, that's a problem.
In 2001, Mary Lateo noticed unusual fibers in her young son's skin lesions. Doctors dismissed her concerns, calling it delusional. But Mary refused to stop searching for answers. She went on to found the Morgellons Research Foundation, which documented thousands of similar cases worldwide. Her work fueled public awareness and controversy. Imagine being a mom, watching your kids suffer, and nobody believes you. That's what pushed Mary to start an entire movement. She turned her pain into advocacy.
And that's the thing, whether you believe in the fibers or not, those families were hurting, and that pain is real.
Okay, fam, let's pause here. Science says one thing, Patients say another. Who do you believe? Drop it in the chat. Team science hasn't proven it yet, or team lived experience is valid?
Personally, I'm team moisturize. Dry skin can't catch me slipping, but also believe people when they say they're in pain, period.
Exactly. Dismissing folks is easy. Listening and researching harder. That's the real work. Beyond the studies, beyond the medical reports, are the voices of patients. They speak of lesions that don't heal, fibers that emerge from their skin, sensations of crawling and biting that no doctor can explain. To them, Morgellons is not theory, it is daily life. Fam, listen. I read dozens of stories online, and the theme is the same: pain and dismissal. One patient said, "I'd rather have cancer, at least then doctors would believe me." Can you imagine? It's not just the sores or the fibers. It's being told over and over again that what you're feeling isn't real.
Let me just say this, whether or not science has the answers yet, we don't get to tell people their pain isn't valid. That's not how compassion works.
Exactly. Just because we don't have the whole picture doesn't mean the picture isn't real.
And baby, if my skin's doing the cha-cha with fibers, believe me first, debate later.
Patients describe the same core experience: lesions that don't heal, sensations of bugs crawling under their skin, and colored fibers emerging from wounds. Some lose jobs, some lose relationships. Almost all described losing trust in the medical system. One patient said, "The sores hurt, but the loneliness hurt worse." That hit me, because this isn't just a health issue, it's a human issue. So fam, real talk. What do we do when science hasn't caught up yet? Do we dismiss people? Or do we listen and support while we wait for answers? Drop your thoughts below.
And while y'all debate, I'll be over here making my doctor work for that copay. You will listen to me, sir.
As you should, Milo. As you should. Not all illnesses are visible, and not all suffering is caused by infection or injury. For Morgellons, some researchers argue the symptoms may not be from a parasite or pathogen, but from the mind-body connection itself. Fam, here's where it gets tricky. Some doctors say Morgellons might be linked to conditions like delusional infestation. That's when people feel bugs under their skin, even though none are there. Now, before you roll your eyes, remember, the brain and body are connected in powerful ways. If stress can give you ulcers, if grief can make your chest hurt, why couldn't the brain create real sensations in the skin?
Listen, baby, if my brain is making my skin itch, then my brain and my body need to sit down and have a meeting, because I didn't sign up for that drama. But I get it. Mental health is real health. Pain in your head still feels like pain in your body.
Milo, exactly. You nailed it. Studies in psychodermatology show that skin and brain communicate constantly. Stress and anxiety can worsen eczema, psoriasis, even hives. Some researchers suggest Morgellons may fall into this category, a powerful psychosomatic expression of suffering. But others argue the fibers patients report are physical, not imagined. Fam, let's be real. Whether Morgellons is caused by a mystery infection or a mind-body loop, people are hurting. And dismissing then helps nobody. Compassion and curiosity, those should be the first treatments. So tell me, what do you think? Is Morgellons a mystery disease science hasn't caught yet, or a powerful mind-body response we don't fully understand? Drop your thoughts in the comments.
And remember, therapy and lotion, baby, double coverage.
Morgellons remains unsolved. Some call it delusion, others a yet-to-be-discovered disease. But one truth is clear. Patients deserve compassion, research, and answers. Fam, here's what I've learned diving into Morgellons. The medical world doesn't always have quick answers, but that doesn't mean people's experiences aren't real. Whether it's science waiting to catch up or the brain-body connection playing out in ways we don't understand yet, folks are suffering. And suffering deserves empathy, not dismissal.
So here's my take. Believe people first. Science will catch up eventually. And in the meantime, lotion, therapy, and love triple combo.
Lotion, therapy, and love. I think that's the cure for half of life's problems right there. Morgellons disease stands as a reminder of medicine's limits and of humanity's responsibility to listen. We may not yet know what causes it, but we know compassion is part of the treatment. So fam, what do you think? Morgellons, mystery illness, mind-body loop, or something science just hasn't named yet? Drop your thoughts below. I'll be reading every comment.
And remember, whatever it is, believe people, boo. Always believe people.